Okay, good deal.
I don't have a gavel. This is about as close as we can get, and I'll call us to order and let the clerks call the roll.
Glenn Whitley, County Judge.
Here?
Roy Charles Brooks, Commissioner Precinct 1.
Present.
Andy H. Wynn, Commissioner Precinct 2.
Here.
Gary Fickus, Commissioner Precinct 3.
Here.
J.D. Johnson, Commissioner Precinct 4.
Here.
Constitution 4.
Thank you, and I'll now turn it over to Charlie Fowler for the hospital.
Thank you, Judge. I have been advised there is a quorum of the board present. Therefore, I'd like to call this meeting of the Tarrant County Hospital District Board of Managers to order. Thank you.
And I'll turn it over to GK now for the presentation.
Thank you, Your Honor. Members of the court and members of the board, just a few housekeeping items before we get going. First of all, each of you are going to be sharing a mic, and since we are live streaming this particular meetings, we ask that whenever you make any comments that you speak directly into the mic. They should be live. Second of all, those of you who parked in our garage, after the meeting, you can see Vanessa. Vanessa, stand up. No, go ahead and stand up.
Didn't we? Any consequences to whatever you do to him tomorrow, I will protect you.
We just talked about harassment training earlier.
And we all know who needs it, right? If you'll see Vanessa, she'll be more than happy to stamp your ticket for you. We are, as I said, we are streaming live, so this is going to be on our website. And also, before you see a copy of the Blue Ribbon Committee's report. We sent this out electronically to the group last Friday. There's one difference, is that while you see the Blue Ribbon Committee report, the electronic version also has attachments A and B, and those attachments are the full reports of Cumming and also of HMA. And for those of you that would like to dive into the detail on those reports, I think we estimate that the total pages on those reports come to about 500 or 600. So, but I will encourage anyone who wants to really understand the details in the analysis that was conducted by this committee. Those reports are very telling because the committee heard those reports and they accepted them and approved those reports. So with that, let me go ahead and start, and then I'm just going to make some introductory comments, and then I'm going to turn it over to our two co-chair. And if we could have slide number 2, please. Okay. First, let me say that the Blue Ribbon Committee, it's interesting, the Blue Ribbon Committee actually started its first meetings in February of last year. So the work that you see today and the reports that you see today are a accumulation of work that our committee members have done, and believe me, we have asked them to do a tremendous amount. They have met as a group, they have done tours, they heard reports, they did analysis on this effort, and we're very thankful for the work of the board. You might remember that the board consists of 12 people. 2 of them which were appointed by each of the members of the Commissioners Court, and the court had appointed 2 co-chair. And as you see, the 2 co-chair are in front of you today. And rather than just simply going through this list, you can see who those members are. Also, there were liaisons from both the court and the board. From JPS, Dr. Lowry and Mr. Petty were the liaisons. And from the courts, we had Commissioner Brooks and Commissioner Wynn. So what you'll see today is a report, a presentation on the report. At the conclusion of the report, after any questions that are asked or answered, then we are going to ask the Commissioners Court to do a receive and file on this report. This is just simply the beginning of an effort. I consider it phase 1 because there's a lot of work that needs to be done yet. But I know that you all have read the report. It's very, very interesting when you look at the front piece of this report and look at how in-depth research and comments were solicited from members of our community. And so the reflections of those comments and ideas are embedded within this report. So with that, I will turn it over to the two co-chair and Mr.
Okay.
Lorraine Miller
Rand?
and Randy.
Randy,
Morrison.
why don't you go
Yes.
first?
Okay, thank you, Lorraine.
By the way, these
Yes.
guys are fabulous together. They help make this committee what the committee is. So.
Well, thank you, GK. Thank you. Thank you, GK. That's very kind of you to say. And I think both Lorraine and I are very grateful for having this opportunity. And I know she's going to say a few things here in a minute. But we did want to recognize those members of the committee that are here today. If you could just stand up for a second, because without you guys, we couldn't have put this together. I know we got at least a few of them right here in front of us. Any other committee members?
Yeah.
Okay, thanks, y'all.
Thanks.
Appreciate it. I also want to thank you for selecting Lorraine as my co-chair, because she has been fantastic.
Yes, I am.
We have, and you are. And I mean that sincerely. You know, when I got into this, when I was asked to do this by Commissioner Fickus, I really didn't know what I was getting into. I was worried about would this be a process where we would be constantly politicized and be getting bombarded by everybody that you could think of. And in fact, a couple of people I told that I was doing this said, well, good luck. I feel sorry for you. And it wasn't that way at all. I can tell you that nobody from either the commissioners, John Peter Smith, anybody, nobody came to me, and I don't think they came to
No.
Lorraine either. They really let this process
Work out.
work
Itself.
exactly the way it was supposed to work. And so it's been an honor to have this opportunity. So I'm going to turn over to Lorraine.
And thank you, Randy. It has been a real joy.
Yeah.
We didn't know each other. We've come to like each other a lot, and it really has worked out, and I think we've done a good work. I'd like to thank my commissioner, Roy Brooks, for offering me up for human sacrifice.
Anytime.
But this has been, I wish a lot of you could have been in the room with us as we were deliberating. We were devoid of politics, but we had some very robust discussions. I think our fellow committee members, and I think it's important that you see the people that we had discussions with. And so we're going to get into our report so that you can see the results of what we've done. Hi, Scott. Some of these folks, Scott is the chief of staff at JPS, and he's a nice guy. He and Marianne are on it.
And, you know, we need to thank, I think, two groups of people. John Peter Smith obviously provided us a lot of support, but
Right.
Marianne and Scott were leading the charge in terms of getting us information that we needed from John Peter Smith and just clarifying things for us. And I really want to recognize both of you all. You did a great
did a
job.
great- So is Mr. Early here?
He's here
I know.
somewhere right there.
We just wanted to make sure. Okay.
And the other group I want to recognize, too, GK's staff.
Yes.
Because,
Oh,
man,
yeah.
they
Oh,
were
yeah.
providing us input. There really is a lot of work that went into this. And without those two groups that we just mentioned providing us lots of information on almost a real-time basis, I don't think we would have made nearly the progress we did. So thank you, GK, to your staff. Thank you very much.
Ladies and gentlemen, we're here to tell a story of what JPS means to Tarrant County today, about the relevance of national trends in healthcare to JPS, how the residents and professionals who use the network perceive its impact on the community, and how current healthcare delivery systems was assessed, and how rapid growth will affect JPS. We will identify areas that need improvement, recommend future operational strategies, and recommend a capital projects plan that we think will serve the residents of Tarrant County. Slide 3. The JPS Healthcare Network is an important asset within the overall public-private healthcare community. Its facilities are located throughout the county in neighborhoods where patients live. And you don't really understand the impact of that until you go out there and you actually see people who are availing themselves of the services right there. We toured one of the facilities in Arlington. Fantastic. There were 128,598 emergency department visits. Now, that means that there was an average of 352 visits a day. 352 visits a day. 27,913 inpatient admissions and 1.2 million outpatient visits right here, Tarrant County.
And to give you a perspective, that makes our hospital, our community's hospital here, John Peter Smith, it makes it probably, we couldn't verify this, but we know it's at least in the top 20 to 25 hospitals anywhere in the country in terms of visits. The reason why we couldn't absolutely clarify it is because everybody measures visits just a little bit different. So that 129,000 visits that she just mentioned does not include urgent care visits. So if you put the urgent care visits on top of it, you're probably looking at, I'm going to say, somewhere in the top 10 to top 15 in the country. So it is a very significant ED.
JPS has over 40,000 JPS Connection members. Hello, I'm one. I couldn't find a private physician when I decided to spend more time in Fort Worth. And so Marianne and Scott hooked me up with JPS. And so that's where I'm getting my health care. So I'm one of the 40,000s. Its behavioral health clinic had almost 30,000 patient visits. Chances are that if you ask most doctors in Tarrant County where they did their residency, they will tell you it was at JPS. JPS offers 13 clinical residencies and fellowship programs with almost 300 JPS residents enrolled. In addition, there are 100 educational programs affiliated with agreements with over 2,000 medical and graduate student participants.
You can see some of the universities that we are affiliated with. And I can tell you, having been a former CEO in this area, the family practice residency program is second to none in this country. I think if you asked 100 people on the street, though, in Fort Worth, Texas, do you know that we have a family practice residency program? They wouldn't know that we had that. And if you said, did you know it's considered the best in the country, they wouldn't know that either. It's a good chance that if you have a family physician here in Tarrant County, there's a real good chance that they came from this program. It is considered one of the best anywhere. So I think most people are aware that a consultant was hired to analyze the current and the future health needs of Tarrant County and to evaluate the demographic changes that are going on here. No question. We all know the growth is terrific. We are anticipating another million population over the next 20 years. And so we took all this into consideration. Prior to this Blue Ribbon Committee coming together, there had been several focus groups commissioned throughout our community. And there was not only focus groups with the public, but there were interviews with probably 90% of the hospital CEOs, if not all the CEOs in Tarrant County, to get their input, really basically trying to get the feedback of all the stakeholders in Tarrant County of what we would like to see happen with John Peter Smith. And many different opportunities were identified from that. Our committee, we took a tour, actually a couple of tours of the facilities, and it was an eye-opener.
Yes.
And I actually thought that I knew John Peter Smith pretty well when I got into this, and I'm not proud to tell you that there were a lot of things that I did not know about John Peter Smith, even though I'd been here for 30 years. But it was an eye-opener for Lorraine and myself. It was an eye-opener for, I think, everybody on the committee when we had this opportunity to take the tours and see what was going on there. One of the things that we see or that we saw is that in our hospital we have a lot of semi-private beds, and in some cases we have three beds to a room, and that is clearly not something that we see as being a good situation for our patients. We did get to see the behavioral facility. We did get to see some of the community centers. We did get to see what we consider a less than ideal situation as far as how we triage behavioral care patients from the 10th floor to the behavioral facility. And by the way, I think I need to make a statement here real quick. And Robert, I want to give you kudos for your team that does exceptional work in our community, even though the facilities are probably not as conducive to good care as they could be. It doesn't mean there's bad care. There's great care. But one of the things we really feel obligated to do is to give your team the same tools that every other facility has in our area. And I got to compliment you on when we did our tours over and over and over again. We saw people that were dedicated. They weren't putting on a show. You can kind of tell the difference between when you do a tour, whether or not everybody's kind of acting out or whether there was something behind it. And I think
They weren't
the whole committee was impressed time and time again, the commitment of your staff. And so kudos to what you've done over there.
But you know, until you take the ride up to the 10th floor and actually see it, I see some of our committee members shaking their heads. It was astonishing, and we had to wait until they were bringing a prisoner in handcuffs, and we had to wait until in a little holding room until they had completed that. But that was all. It was quite alarming to see that that's something that people will have to endure to get the kind of psychiatric services. It was very illuminating. We talked about that at our next meeting. That was the cause célèbre, the topic that everybody talked about. Did you see the 10th floor? What's going on there? We just cannot, as a county, tolerate that kind of operation there.
By the way, I think most people know this too. Not only do we utilize the services of one consultant, we utilize the services of two consultants. So we were getting opinions from two different very good groups, HMA and Cummins, and that's on top of the report that I think you all saw in 2014, which was, and I've just forgotten the name,
Blue Cottage.
Blue Cottage, thank you, that report. So we have had a lot of good input on the statistical analysis that we needed for our county and for our hospital. So looking at the the growth has negatively affected the operations, not negatively affected the care. I want to tell you, it's good care going on down there, really good care. But it does affect the operations. It makes it more difficult for them. It's like, carrying an extra sack of cement around. It's not that you can't walk with it, but it sure makes the walk harder. And we'd like to get rid of some of that cement for those guys. And with the future growth coming in, we have to do that. It's incumbent that we do that. When it comes to healthcare professionals, John Peter Smith is not unique in this way because every city in America struggles with having enough professionals. And the fact that we're in a high-growth area, it just exasperates it that much more. So it is incumbent upon us to continue to grow the healthcare professions in our area because that's going to support not only John Peter Smith, but all of the healthcare that's provided in our county. Let's see, I'm taking you up to, I guess we kind of skipped ahead a little bit here in our talk, but that main tower got a lot of focus. By the way, the focus groups, if there was one thing that came out over and over again in every single focus group, it was the concerns for behavioral health.
Yeah.
Not
Absolutely.
just John Peter Smith, but I mean just as a society and what we're dealing with. So you have the growth of population, you have the what we consider to be not ideal facilities, and then you have the cultural growth of what's going on with behavioral situations. When you put that mix together, that's a very difficult mix, and that's a big challenge for not just John Peter Smith, but for everybody, but particularly John Peter Smith, since it is the biggest provider of behavioral health in the community.
When we walked down going back to the tour, when we walked down the hall and saw that tunnel,
Yes.
if you're on the 10th floor, then you're brought down to the first floor, and then you got to go through the tunnel now. So if you're already having behavioral issues, you'll really have behavioral issues by the time you're on a gurney or something.
Yeah.
Going down this tunnel, it's dark, it's a little dank. We need to do better. We just have to.
Now, I would like to be down there the next time there's a tornado, because I know I'm going to be safe down there. It is way down there.
And long.
Yes, I know I'm going to be safe. But that kind of speaks to the facility itself. As we went through it, and we got different diagrams and charts of the facility from Scott, it's apparent that, like many public hospitals, it's a series of, it's a generation after generation, Band-Aids on top of Band-Aids. This is not unusual, but that doesn't make it good, okay? And you have some of our core structure at the hospital is 1930s vintage. And you got 1960s vintage. It's almost like an archaeological dig over there. You say, well, here's the 1960s. And let's go over here. We can find the 1980s. It's real. I'm not kidding either. But don't criticize John Peter Smith for that. That's the way a lot of public hospitals have gotten to. And now it's time for our public hospital in Fort Worth, Texas, to catch up and do something about that. 60% of the rooms are semi-private. A lot of the codes that we have in place now for hospitals, I can tell you we wouldn't meet it. Now, it all gets grandfathered in, so we're legal. Don't worry about that. But when you start to think about, well, should we replace this or should we rehab it, you have to start thinking about things like the windows. The windows wouldn't be up to code. The ceilings wouldn't be up to code. The mechanical, the plumbing, the electrical, all these things that have to be brought up to code anytime you rehab it. And when you start rehabbing something that difficult, you begin to start saying maybe it's better to replace, which we'll be talking about in just a little bit.
I think one of the main points that we want from the report for you to understand, especially the Board of Managers and our commissioners, you can't piecemeal it. You can't just put a little, okay, we're going to do a little bit here, and we'll worry about that down the road. Piecemeal is not working, especially when we know we're having 1 million people. Just think, 1 million more people who are needing these kind of services. We just can't piecemeal anymore.
No. That's what we've got.
Yeah,
We've got
that's what we've
piecemeal
got
now.
piecemeal, and we've
Yeah.
got to be much more strategic.
Yeah. Again, this is no criticism of anybody or any leaders. It's just kind of the way things evolve over time, and now we're doing something about it. Okay? So you want to talk a little bit more about the behavioral facilities?
Well, yeah, and our existing JPS behavioral health facilities are not recommended for inpatient services. The total number of psychiatric beds throughout Tarrant County are well below the current need level. So combined public and private facilities total, public and private, total 550 acute psychiatric beds. JPS has 132, or 24% of those beds. 96 of the JPS psych beds are housed on campus. The other 36 are located at a satellite facility. In 2015, JPS transferred 3,100 psychiatric service line patients to other hospitals and paid an astounding $3.1 million for the portion of the patients who had no resources. Randy, I know you.
If I could just add one more little
Yeah.
thing to that too, which does not show, because there's no way we could actually reflect the cost anywhere, but when a patient gets transferred to another facility, we as John Peter Smith, we lose track of that patient. Now, why is that so bad? Well, because for continuum of care, to make sure that we're using the optimal resources and making sure a patient's going along the right track, when they get outside the system, they may possibly start going on another track, maybe more expensive, maybe less expensive, but then they come back into the system again, and then we have to either redo tests or put them back on the protocols that they had before. All of this is duplicative, it's expensive, and it's not good for the patient. So the $3.1 million is just strictly a leasing expense. That's something we can actually identify. The cost that I just described may be double that for all we know.
Yeah. Further, many of these hospitals are not equipped to take care of the most complex patients with serious mental illness that seek care at JPS. So we're incurring a lot of expense, outsourcing, and then it's dubious about the care that they may be receiving.
Yeah.
Specific behavioral health shortcomings. JPS relies on semi-private rooms that may be 3 patients in a room, but patients with behavioral health diagnoses are unsuitable for that type of environment. Service centers are spread across the campus, with patients undergoing intake and emergency treatment on the 10th floor, our infamous 10th floor tower, and are then transported by elevator to below ground level and taken through a long tunnel to the Trinity Springs Pavilion. That's inefficient from a staffing standpoint, and it's problematic for patient care.
And that could also be problematic for the non-behavioral patients, just to try to get your arms around this. So if I'm a behavioral patient and I am self-admitting, in other words, I need some help, I know where that 10th floor is, so I'm going to get on the elevator, which everybody else gets on too. Okay, the non-behavioral, and I'm going to be riding right up that elevator. Now, 99 times out of 100, that's going to be fine, but you are incurring potential risk with that mixture of patients. So that's not even reflected in this report. We're just trying to give you an idea of just how badly we need to make some changes there. Okay? So anything else you want to say about behavioral health?
Well, I think we've covered that.
I know. We probably spent a little bit too much time on it, but cannot underemphasize, or overemphasize, I should say, the huge need in that area. So we also looked at the community, how the community receives care. We've learned that primary care physicians John Peter Smith has them throughout our community in a lot of different ways, not just through the tower over here that most of us see. The HMA report recommended that to meet the goal of serving the needs of at least 50% of the JPS connection eligible clients, JPS would need to open an additional 19 community health centers over the next 20 years. We think it's critical for health systems to continue to shift the emphasis from the hospital care to an ambulatory care setting. And that is definitely a trend throughout our country, and that's a good trend. That's the best thing for the patient, is if we can keep them out where they belong, as opposed to coming into the heavy acute care, heavy expense environment of every hospital in America. That's a trend we'd like to be on top of rather than behind. And we've got to provide more facilities for that. Were you going to say something, Lorraine?
That became a big discussion. We got into a half a day almost of discussion on transportation. A lot of people, the folks that we're trying to serve at JPS, won't have transportation if they don't have a car or somebody to take them. And we know that our bus system is not the robust in the country. And so you're having the community centers, health centers where people live is the way to go, because it's much easier for them to get there, and they receive the top quality care that Mr. Early is going to prepare for.
Well, they can get it early on. No pun intended, Robert. Yeah. I didn't mean that. But they can get it early on out there, because if I've got a community center that I can get to pretty easily, I have a more likely chance of doing that. And if my only opportunity is to come all the way into Fort Worth to the hospital, I may put that off even farther. And now the medication that I could have gotten out in the community, now I didn't get that, and now my congestive heart failure is in a very serious situation, and I could have avoided the whole thing had I gotten that care out there. So that's really what we're trying to get at. So convenience as well as safety, as well as just better care all the way around. So as the population grows, of course, Tarrant County is also going to see an increase in the JPS connection eligible population, as well as those who are underinsured or uninsured, which we still have not solved that problem. A lot of people think we've got that problem solved, but we don't. And it looks like it's just going to keep on going for a while. So we can't think that, well, oh, good, it's all behind us. No, it's not. It's a real challenge. So we have some strategic recommendations here. Lorraine, I think you were going to talk a little bit about how sobering all this has been.
I think every member of that committee thought this report the information we received was very sobering. Even though some members of the committee knew already the challenge issues, I think our two commissioners that sat on our commission and our two liaisons from the Board of Management, they knew it. But the actual facts uncovered by the consultants indicated to us that significant improvements needed to be made at the JPS network. We will split our recommendations in two parts: the strategic improvements and capital projects. The strategic improvements address the operational side of JPS. The sustainability of JPS requires an integrated delivery system. We had a long discussion one day about being in silos. Sometimes it seems as if we're just looking at JPS alone, and we've got to look at the healthcare community in Tarrant County in totality. JPS cannot function alone, but it's got to be an integral part of it. And so an integrated delivery system is what we are recommending, which you're already doing. You're already doing, but we recommend that it's It continues and is much more robust, which includes working with the other hospital systems and community providers to serve the low income and underserved populations. JPS should continue to invest in human resources and health information technologies, continue its efforts to strengthen health management capabilities affecting the overall health of Tarrant County residents through a new and improved method in preventing and detecting disease. You know, we're not the city, but I attended the mayor's State of the City, and I personally may not like the bicycles because they get in the way. And bicyclers sometimes tend to have their own way of driving.
Attitude.
They have an attitude, absolutely. But I can't take away from the health benefits of bicycling and the preventive care. I think one of the things she tried to stress was, ladies and gentlemen, we got to get out there and move. We got to exercise. That helps to prevent a lot of diseases. And a lot of these things are preventable if we educate the community and let them know simple things that they can do so they won't have to rush to JPS for an emergency. And so that's we had a robust discussion about how we have to work within the Tarrant County community, Randy, to get this done. Okay. We recommend that JPS lead planning efforts to improve the countywide behavioral health system of care that includes substance abuse services, jail diversion programs, and strategic psychiatric services. The point here is, JPS, we're the leaders. You are the main emphasis. You are the
Main provider.
yeah, the main provider. Without you, our healthcare system in Tarrant County doesn't function. And so take the lead, take the reins, show the rest of Tarrant County's health community what they need to do. But you're in a great position to do this. In order to address the shortage of healthcare professionals, the committee recommends that JPS lead a countywide effort related to graduate medical education and other health professions in training and recruitment strategies to meet the needs of Tarrant County population in coming decades. Further, the committee recommends an alliance between JPS and the Tarrant County Public Health to address the social determinants of health through policy and other efforts to create healthy social, physical environments. Priorities would include education, employment, transportation, including access to healthy food, safe neighborhoods, stable housing, health care. Randy, why don't you...
Want to talk about money?
Yeah.
Now, we're talking about, this is a $64,000 question. Actually, it's a little bit more than that. So just want to give you a little warning. It's more that you got to add a couple of zeros to this. So let's talk about capital because, I mean, and I have to admit, when I first, Commissioner Fickus first asked me about this, and subsequently Judge Whitley, I was concerned that was this just going to be a committee to come up with a wish list. And the reason why I was worried about that is because I used to be CEO of a hospital too, and that's what we want. We always want stuff. Our technology is always, moving, and every CEO of a hospital wants more stuff. But I can tell you there was very significant thought put into this, and between the observation of what we saw and listening to various communications about what our needs were and so forth. I can tell you that none of this is a wish list.
Yeah.
None of it. This is we really need to do this list. And we recognize right at the front end, this is going to be an expensive ticket. And I really want you to know, and I think Lorraine just said, I went into this not looking to put together a Santa Claus list. I went into this looking, I'm going to be real, because I don't like paying higher taxes either. Okay, I'm a homeowner, and I see my little line item there. So I went into it with that mindset. So what you're getting ready to see are things that we really believe need to happen, not, gee, we wish, we hope, we whatever.
And there was discussion among the
Yeah.
committee aggressively about it. And even though we were not mandated to come up with a price tag, to say you've got to do this within a $20 limit, we looked at it as we've got 1 million people descending upon us in the next few years. We already are underserving the communities that we're trying to accommodate. And what do we do?
Yeah.
And our recommendations don't go to the full fruition, like the full board of maybe we need 1,000 hospital beds. You know, we went to reality, a dose of reality of proportionality of what we could do.
And we took all the recommendations from the consultants into our thinking in terms of determining what is a reasonable number. One key sentence that's up on your overhead there is the committee's recommendations are unanimous.
Yeah.
This was not some, 8 to 7 sort of vote, root canal process where we're yelling at each other and pushing back. No, I'm telling you that this was unanimous, and on the project prioritization, I mean almost every one. I think we did a 1 to 5 scoring system.
Right. We did.
I think the lowest score was a 4.9 or something like that, and we were splitting hairs to even get to that point. So I just want you to know how much the committee is behind this. So let's take a look at the community health centers, a key part of the John Peter Smith strategy over the next 20 years. Okay, so you have 13 community health centers right now, and in order to meet the need as projected by our consultants based on our demographics and growth and so forth, is that we need to be building 19 more over the next 20 years. We are actually recommending that John Peter Smith build four over the next 5 to 10 years, okay? And you can see up on the overhead where we have prioritized those 4. They're in South Arlington, Southwest Fort Worth, West Fort Worth, and Northwest Fort Worth. And with a caveat, or not a caveat, but maybe a special asterisk that there was also a recognition that up in the Mid-Cities area where we're building currently a new medical home over on the Euless side, as you all know that are in the Mid-Cities, that's a pretty broad band geographically, and 820 is a major dividing line. We actually think that somewhere in that Haltom City, Richland Hills, if you kind of know where that all comes together, is probably a good spot also, and should be, if it's possible for us to finance, to rapidly get into that prioritization area.
And these are areas where growth projections, one of the consultants went in depth to give us some projections of where the growth populations were likely to be.
Yeah, so a critical part, we cannot build enough beds down here to take care of all of Tarrant County. If we don't hit these critical spots, we're just going to either overload this hospital or we're going to overload the existing hospitals out in the community. It's just, you've got to have that outpatient footprint. Let's get back to the behavioral health facility. Again, looking at all the numbers and so forth. So we concluded that we are very grossly in need of more beds. I think Lorraine talked about we're already spending $3 million a year just to offload to some of the private hospitals like Millwood and Sundance, Ocean, as you heard of some of these private facilities in Tarrant County. So we need to utilize them. We also lease some beds in another facility. I don't know exactly what that number is, but the bottom line is there's a lot of money that's being paid out today, and that's not even sufficient. So we feel like a new facility is needed with private rooms, of course, and all those services located within one location for acute inpatient determination. HMA determined that JPS would need to provide approximately 1,032 beds in 20 years to meet the behavioral health demand. Yeah.
Just the behavior.
Yeah. If JPS plans to meet about one half of this need, it's going to take about 516 beds. But knowing the financial implications, the restrictions, the difficulty, we're recommending right now that we build a 298-bed facility, and that the current facility needs to be completely replaced. We do not think it is practical for it to be rehabbed.
So to reduce the impact of the projected demand on hospital beds, it's critical, we believe, for JPS to continue to shift the emphasis from hospital to ambulatory care. Therefore, the committee is recommending the construction of an ambulatory surgery center adjacent to the main JPS Health Network campus. This surgery center would alleviate capacity demands on the hospital and move lower acutely surgical cases to a more appropriate low-cost setting. It could include specialty clinics, especially surgical specialties, to maximize physician efficiency and patient convenience.
If I could dive in here for
Sure.
just a second on this particular one. This might sound to a layperson like, oh, that sounds like a Santa Claus sort of thing. You just kind of put that on the wish list. I want to tell you, I was shocked that we did not have a separate outpatient surgery. I just assumed we had one the whole time. So shame on me for being ignorant. But this is a priority, not only from a standpoint of efficiency, but when I think about if I was in Robert's shoes, to try to organize surgery, and then you think about the surgery that comes into John Peter Smith, a lot of heavy-duty stuff. We are a level 1 trauma center, and that's going to remain that way. And then you try to mix in the outpatient. I can tell you from a scheduler standpoint, I would hate to be the OR director, Robert, if I was. He must be a saint, because you're trying to keep your patient that's in there for relatively easy, I mean, I know no surgery is easy, but relatively easy outpatient surgery, who thought they were only going to be there for an hour. But unfortunately, we've had 2 gunshot wounds and 3 motor vehicle accidents come in. And I know, Mrs. Smith, you thought you were going to be here for just a couple of hours. And I know it's now 5 o'clock at night, but we really do think we can get you in. You know what I'm saying? This kind of stuff happens all the time when you try to mix outpatient with traumatic type stuff. And I really hope that y'all don't look at this as a kind of like, oh, they just need that. It'd just be nice. No, they need this. We're way behind on this one. So sorry.
And that
Sorry,
happened to me. I had a little minor surgical thing a few months ago at JPS, and I went out to the Arlington facility. Done. I mean, I was in and out within a couple of hours.
Yeah.
But had I gone to JPS downtown, down the street on Rosedale near the house, I'd probably still be there trying to get being facetious, but I want you to get the point that going out to Arlington was quicker.
And that gets to the point that I said earlier. So does that mean that we're rendering bad care?
No.
No. That same surgery is done by trained professionals, the best in the business, and they still have a good outcome, but it is inconvenient in a big, big way.
Yeah.
And it's also inconvenient for staff, and it's inconvenient for schedulers and everywhere down the road. That's what we're talking about.
Even the existing cancer center is not directly on campus, but just down the street on West Terrell. It is a constrained and outdated facility. The size of the building is not big enough, and it can't support all the services, and there's no room for expansion or growth. So you're stuck.
Yeah.
So the current setup and the infrastructure of the site does not support current standards of medicine, and it is not conducive to patient-friendly care and recovery, which is especially important to cancer patients undergoing a series of treatments. The services would be more ideally located in a dedicated, patient-friendly new cancer center or near the main campus. We have already listed the shortcomings of approximately 100-plus-year-old John Peter Smith Hospital. Randy talked about how it's an archaeological dig, but the last time an update was financed was in 1985. Additionally, JPS assumes 45% of the costs countywide for uncompensated care. Given the uneven distribution of hospital bed demand for persons with low income, JPS has demand far beyond its capacity. And population growth and the aging of the population will put additional strains on JPS and other hospitals within the county. In determining the number of beds needed over the next 20 years, HMA reviewed the need of beds for Medicare, for uninsured and JPS connection patients in order to maintain the same level of needs now being met. It also looked at the 2014 report from Blue Cottage. Okay? Therefore, the committee recommends that a new patient tower be built to serve Tarrant County residents well into the future. Further, the committee recommends the tower have 676 beds. This includes adding an additional floor with 60 beds to the HMA recommendation.
So finally, on behalf of the Citizens Blue Ribbon Committee, we're almost at questions here. I would like to thank again the commissioners for the foresight and the impetus to study the future of the healthcare here in Tarrant County and how it will affect the John Peter Smith Healthcare Network. And of course, for the health of everybody here in Tarrant County. We're all honored to be chosen for this. We appreciate the confidence that you all have put in us to pull this off. You know, healthcare is very complex. There's never an easy answer when it comes to healthcare. There never has been and there never will be. But that's okay. That's one of the things that makes healthcare so interesting. Right, Robert? So collectively, we hope that you, as well as the Tarrant County community, not only embrace these recommendations, but we also consider them to be a call for action, basically, for the public and the private sector to work together towards this vision. And before I open it up for any questions, I would just ask our Blue Ribbon Committee members, is there anything that any of y'all would like to add to Lorraine and my presentation today? We tried to do a good job of representing the committee, but is there something we missed out on that you feel like we need to give a little emphasis to? Okay. You all right?
Well, you know what?
Okay. Yes, ma'am.
There's one thing last thing I want to emphasize. This really is a call to action. We sit here and we've come up with lots of numbers and And what all this says to us is that we've got to do something. We've got 1 million people coming in here, ladies and gentlemen. And we've got, if you've ever toured the hospital and you see people waiting in line, I mean, it's almost, I've been to probably Nairobi, Kenya, probably 10 times and visited hospitals. And that was the immediate thing I saw. I said, oh my God, here we are at home, America. We're great and beautiful and the richest country in the world. And we have people waiting in lines like in a third world country.
Yeah.
That's unacceptable. And especially if we have hordes of people coming into our communities later on. We got to prepare. So this is a call to action. You may not be able to do everything that is in this report, but everything in this report needs to be done.
Yeah, yeah,
Thank you.
definitely. So open for questions. Yes, sir.
Mr. Fickus.
Yes. Or that. First thing, I want to thank both of you for the great job you've done, and I want to thank the committee. You talk an awful lot about facilities. Tell us about staffing and I mean, we're obviously behind the curve facility-wise. I'm assuming we're
Behind
probably the same place, but
Yes, we
tell us
are.
about staffing.
Well, we are behind, and I think one of our colleagues, Dr. Flynn, right there, was, he may have a comment or two with Randy and I, but one of the interesting things, I was having my little minor surgery, and this doctor said to me, I said to him, because I'm on this committee, and I said, so, are you a Fort Worth person? He said, no. He said, I did my residency here, and I decided to stay because I like Fort Worth. I thought that was interesting. And I said, so you moved your family? He said, oh, yeah, I moved my whole family, and I mean, we're Fort Worthians now. We need to emphasize that. Now, this is a great community for people to raise a family. And the medical folks, I think when they come here and they do a residency, they ought to be able to stay. And so, yes, we're short.
I think every community wrestles with this to different degrees. Nobody that I know of has sufficient staffing. I mean, it may exist out there, Gary. I don't know who it is. And we have been chasing enough staffing, having enough staffing in I'll just say healthcare for 40 years. And the level of need varies by, if it's in the physician world, by specialty, and it varies by the particular profession within the hospital staff. So, you know, ICU nurses harder to get than general nurses. General nurses harder to get than, you'll say, housekeepers or whatever it might be. But across the board, do we have a staffing problem pertaining to John Peter Smith? In my opinion, no more than we do in the world of healthcare. But we do have some tremendous demands down there. I think as it relates to what Lorraine was saying, I know everybody's going to say, oh, Randy, you always brag about TCU. But I think TCU's new medical school, man, it's going to be a big deal for Fort Worth. It's going to be a real big deal because what you described, people coming to Fort Worth between the, you know, and having the UNT Health Science Center. You know, we got a lot of good things coming. We haven't seen all the fruit from it yet, obviously, but I am really encouraged that the physician world is going to be a better situation coming soon.
You're professional in this, and for that I appreciate it. But do we run into a problem where, I mean, we're not competing against Parkland, we're competing for staffing against every hospital in the area.
Absolutely.
So
Yeah.
if our hospital,
Yeah.
facility-wise, isn't keeping pace, I'm assuming that's gonna hurt us in bringing staff and keeping staff.
Well, here's how it really works. If I'm coming out of nursing school, I want to go to a John Peter Smith because I want to see some action.
Yeah.
I want to learn as much as I can. If I'm a resident, a physician resident, I want exposure to everything I can get because that's how I'm going to learn. And for a lot of those people, they never change. They love that action of a trauma center, and there isn't anybody around here except maybe Harris a little bit because they see some pretty heavy-duty stuff too. But the true level 1 trauma, for those that are attracted to that, John Peter Smith is always going to have actually a little bit of an edge, okay? But not everybody's attracted to that. There are a lot of people that want to be a floor nurse, or they want to be an OR tech, or whatever it might be, and they, not only do they deserve, and I don't mean that in kind of a Pollyannish sort of way, but they have expectations. They did rotations. They saw a rotation at Cooks. They saw a rotation at Harris. They saw a rotation, out in the burbs, if it was my old hospital or HEB or wherever. And so they know what things are available. And so if the gap is too big, you can lose staff because you simply don't have facilities that are conducive to a good work environment. That can happen for sure.
And you know what? It just seemed like the JPS folks care a little bit more. I mean, I've had relatives that have been in hospitals, and you go in and people kind of treat you as, okay, you're old, so I don't need to deal with you, or
Yeah.
you're so sick that I don't want to bother with you. But JPS seems to go the extra mile to really care, which makes, I think they want to stay.
Well, I think they do a fabulous job, but I have to do a Chamber of Commerce commercial for all healthcare workers. And I am really prejudiced when I say that because I worked around them for 30 years.
Prejudice.
I'm prejudiced for healthcare workers.
Okay.
I don't care whether it's like football. I don't care what your uniform is. You strip off the uniform and you have a football player. And they love to play football.
Right.
I can tell you, honestly, that I could go to any hospital in Tarrant County, and really probably anywhere in the state, and they may be my biggest competitor, and we may just duke it out. I've got the better heart program than yours, or we do more than you. But at the end of the day, I can tell you that those people that are on the other side of the line,
Right.
so to speak,
Yeah.
they love them just as much as we do. So, but I do agree with you. The John Peter Smith staff that we saw, they weren't complaining.
No.
Robert, they weren't saying, oh, you guys are with the committee. Good, you need to get us A, B, and C. No, they were just dedicated to what they were doing. And I'm not going to undersell what we saw, which was very impressive. Now, I will say, compared to other public hospitals, I do think the John Peter Smith team, I think they are a cut above the rest. And there's a reason why they got top 100 employer. That wasn't in DFW. That was in the country. Okay, there's a reason they got that. So I do agree with you that they are a cut above.
And I guess I would just say this, I think in any business, in any industry, in anything, you have, hopefully for the most part, a good majority, if not a very significant majority of folks who like being there and want to be there and want to do their best. And in every one of those organizations, you have the people who are there for an 8-to-5 job and just,
And
make sure I get my
yeah,
paycheck on Friday.
Sure.
And I'll give the minimal amount of effort I have to be able to stay there and get mine. But I think you're exactly right, and I think it always comes from the top.
Yeah.
And it comes from the people who are saying, what are our priorities?
Yeah.
And as Robert has said, one of the big priorities at JPS is don't be a jerk.
Yeah.
Yeah. Dr. Flynn, do you have anything you want to add? Because, you're kind of new to the community, but you got that medical stuff.
I was told I have to speak into a microphone.
Yeah.
I'll make this very brief, actually. So I tell every medical student applicant and every resident that wherever they train, they should train where there is a public hospital and a VA hospital, and everything else falls into place. I can guarantee you I would not be here starting this medical school if it were not for JPS. JPS doesn't have to carry everything. So you hit on workforce. So 2 comments to that. So from a residency standpoint, Fort Worth proper could withstand a growth of 500 to 700 residency slots and be at the national median. So that would be in addition to what Robert's faculty and institution already do. It's value added, it's not competition. The second thing I would say, when we talk about these clinics scattered about, and you did a beautiful job on talking about how we're trying to move healthcare outside of the hospital unless it's acute care. Well, once again, JPS has the beautiful chance to be the leader on how we advocate for health. My wonderful opportunity here is not just to train the next generation of physicians, it's to train them with nursing students, pharmacy students, social work students. This is our, Tarrant County, I've been here 2 years, this is our ecosystem. And what we do well, we will do beautifully in Tarrant County. When I say we, I mean the collective we. And then everyone else can follow our lead if they'd like. But at the end of the day, this is where we live, and this is an unbelievable opportunity. And I've said it to Robert many times, JPS is a major pillar on what we should be accomplishing in this county. So I appreciate the chance to basically echo what you both have been saying.
Commissioner Brooks?
I want to thank our 2 co-chairs and everybody who served on this committee for the tremendous work that you've done over the past year. When we first set up the Blue Ribbon Committee, I was against the process. I felt acutely the need to do something and do it now. And setting up this committee felt to me at the time like kicking the can down the road. But I'm so glad we went through this process because it has helped to clarify the issues regarding the current standard of care based upon the current facilities at JPS versus what we would like to see for our community now and 20 to 30 years from now. It's been a very important exercise, and I hope that it will have the effect of clarifying for the community not only what we need, but why we need it, why this is important. Because JPS is critical to the healthcare delivery system in Tarrant County. It is our safety net hospital and our level 1 trauma center. And our probably number 2 provider of mental health services behind our county jail. And we've got to flip that
Script.
script.
Yeah.
Right. So thank you for the work you've done. And once again, I'm ready to do something.
Commissioner Johnson or Commissioner Wynn?
I just want to thank the committee for the work they've done, and I appreciate this report. I'm sitting here thinking as you go through this, I'm one on this court that uses JPS. That is my hospital. My doctor is out there, not because I'm indigent, because I believe in that facility. They stole my doctor from Alliance Airport, bought his practice out there and put him down at JPS, which was a blessing for me because JPS became my hospital. I had some stomach problems 10 or 12 years ago, went through 2 major surgeries in the hospital, and I am a believer in what they do. It's a fantastic facility, but it needs to be improved. Thank you for what you've done.
Thank you.
Yes, certainly. I want to thank both of you and the members of the Blue Ribbon Committee. I've been in every meeting
Yes.
of the committee, have not missed one.
We appreciate that.
And
Yeah.
I saw the debate.
Yeah.
I saw the disagreements.
Participated in
I saw the active participation, and I'm very much appreciative of that. And I want to take this opportunity to thank every members of the board as well. I have been advocating for us to triple your salary.
Which means we'll give you 2 more rounds of applause.
So seriously, it's managing a $1 billion hospital organization with your volunteering time is a lot of sacrifice. It's a lot. I mean that sincerely. I have a question for you, and anybody in this room who want to take a stab at it. You know, we basically have 2 set of recommendations. One is strategic, the other one is capital project.
Right.
And the focus tend to be on the shiny objects, right? Which is the buildings, the facilities. Do you think can we just focus on the capital improvements and the capital projects and not so much on the strategic recommendation? Do you think those 2 need to go hand in hand, have the same significance? Or what do you think about
hand in hand.
Hand in hand.
Hand in
hand, yeah.
Because
No, they both are.
they both
Yeah,
are.
yeah,
You
yeah.
have to. What we've talked about on the strategic side doesn't happen on the capital side if you don't make those adjustments. So if they have to go hand in hand. You know, I am a big proponent of prevention. I mean, if that's one thing that I felt that we really should have emphasized more and have more stuff in so that we educate people. And until you've gone to the hospital enough to see people waiting for care or bringing a loved one in for care, when a lot of things could have been prevented, so the strategicness of it and the capital improvements, they go hand in hand.
Yeah, I don't know how you're going to, I mean, certainly we could pick out some things that you could probably do without a capital expenditure, whether maybe an initiative, education initiatives and things like that. Sure, you could. But as far as moving John Peter Smith to the point where they can meet the needs of our community, I mean, look, I went into this thinking I'm going to go into this with a sharp pencil and I'm going to be scratching stuff off. I'm going to get rid of all the fluff on this thing real quick. Well, it just wasn't fluff. I mean, this stuff needs to be done, and I am not a big spending proponent at all. I want you to know that I went into it with the thought of I'm not going to let this turn into a big capital item. And by the time we got done, we got a big capital item. But then again, the reason why we have a big capital item is because we haven't done anything since 1985. That's a long time to go. Things have changed a couple of times since 1985 in healthcare. Really.
Yeah, it has.
And I thought maybe we could rehab the tower. You know, let's go in there and we can sharpen that pencil enough. Well, you know, we sharpened it and it really didn't make any difference. So there's no sense trying to continue to stick more Band-Aids on it. Let's just do it right. I will tell you, Commissioner, I am worried, though, about how we're going to sell this. I'm not worried about Fort Worth, Texas, because Fort Worth, Texas, they're going to get it. Mm-hmm. I'm worried about my community. Okay, I'm Northeast Tarrant County. I I can tell you a lot of people in northeast Tarrant County said, oh yeah, John Peter Smith, that hospital down there for the Fort Worth people. I don't go there. I go to HEB, I go to North Hills, I go to Baylor Grapevine. What does John Peter Smith have to do with me? They don't understand that if they're in an accident on 820 tonight, John Peter Smith is
It's
where
where
the
you're gonna,
helicopter is
yeah,
going.
yep.
If they get shot tonight, John Peter Smith is where they're going. So in fact, it is their hospital. So what I'm really concerned about, and I'm really looking at Glenn and Gary on this, because, you know, we're all neighbors up there, and I think you agree. It's, boy, to get that message out to those folks, and for those folks, I guess, in Arlington, Andy, where you guys are, you know, to make them realize this is their hospital too, because they're coming down here too if they have any of those issues. And they may even come down here because, like you, JD, they're doctors here. Okay, so there are lots of reasons to be really committed to this. But I know the environment we live in, which is don't raise taxes, and I'm one of them, okay? But sometimes you got to raise taxes. Sometimes you just got to do it, and we got to do it.
don't
In
go
a
there,
bond
Randy.
in a bond package, through internal funding. I say taxes, okay?
Yeah.
Let's make sure you understand, I don't think the whole thing needs to come through taxes. I'm not saying that. But for us to think that Robert and his staff can internally fund all those capital projects, that's a scenario that.
But it
that
is
math doesn't
still
work.
an open question
That math doesn't work.
as to whether or not things can be scheduled in such a way that we don't have to raise taxes.
I hope.
I hope too.
I hope.
Yeah.
You've got some urgencies here, though.
Yeah.
A lot of urgencies.
Let's
a lot
leave
of
the
urgencies.
T word to the side for now.
Yeah.
Randy, and.
I'm sorry, remember, I'm just a
Randy,
citizen, so I get to say this stuff.
Randy, one of the reasons I was excited that you would actually even consider serving on this committee. Andy and I talked about it, and, you know, he said, go talk to him, so we went and talked, but I think what I was looking for, and I hope for my area, because I know Northeast Tarrant County, and it's a little different. And,
Yes, it is.
but I wanted a fresh set of eyes, and we
Yeah.
got 24 of them with 12 of you, to look at this and validate, you know, what the facility needs actually were, and try to validate some of the costs, but also make it a transparent, public process where the public would have an opportunity to, you had numerous meetings, and that's what I wanted. I wanted the public to be able to come and have an understanding of what was going on, so that at the end of the day, we could say, yes, we had a transparent process. We had a lot of different people from a lot of different backgrounds look at the process, and here's a recommendation that we hope we can all move forward with.
Yeah.
And so,
Well,
thank you.
Commissioner, just to follow up on your observation there, you look at the caliber of people that served on this commission. I mean, we come from all walks of life. I mean, I live in the historic South Side, and there's D. Kelly, and there's, you know, it's just a whole group of us. And we all came to a unanimous decision. We did debate,
Yeah.
and people had varying opinions, but when it boiled down to the welfare and the benefit of the citizens of Tarrant County, this is what we came up with.
Yeah. Yeah.
I'd like to ask a couple of questions, and I want to ask you to go back in your slides if you can.
Okay.
First off, let's go back to page 17. And you mentioned there that very first point, reduce preventable duplicate. You know, I've heard hospitals talk about this a lot, but unfortunately, most of the hospitals want to keep the profitable ones and send everything else. So Randy, you've been there. Do you really feel like that you can sit down? Is that what you're talking about specifically, is saying, okay, this hospital is doing hearts, when I was level 1 trauma, we got to do a lot of this stuff. But do you believe that we can bring the other hospitals together and say, okay, we're not gonna do this because somebody else is doing it? Is that what you're referring to? Or is that something else?
Here's where I think the hospitals will come together. Or let me back up. Here's where I think that they're motivated to. Every hospital, almost every hospital, has got an active ER. And that includes the burbs. They run into situations where they also have long wait times.
Right.
And the area that is the most acute is in behavioral health, because they cannot adequately do behavioral health. It's not because they're bad people. They just it'd be like a hospital that doesn't have cardiologists trying to do cardiac care. It's not because they're bad that they don't do cardiac care. It's because they don't have the people to do it. They're not trained to do it.
So you're talking about reducing.
And
in
so
those
I
particular-
think those doctors, those facilities are going to, I think, should be way on board on the behavioral side. They got tons of motivation. Every night they've got that motivation. As far as the non-behavioral acute setting, I could be wrong on this if things have changed, but I don't feel like I'm talking about the burbs now. I don't think that they view John Peter Smith as a competitor anymore. I think that there was a time in another generation where they viewed John Peter Smith as somebody trying to infringe on their territory and trying to get the insured patients.
Right.
I think that's dissipated a lot. I haven't heard that too much.
Page
So I
20.
think, and one more thing, and then I'll toss it back to you. I think that they would also be very much in favor of these community health clinics,
Yeah.
because
Yeah, it helps them.
it takes pressure off of their
them.
ER if you've got people that are getting care in an outpatient setting that shouldn't have ever been in your ER, my ER, or anybody else's ER.
Well, that
Yeah.
segues in,
Yeah.
if you would, go to page 21. Y'all have recommended 4. We've got, Commissioner Fickus has one going in on Highway 10 right now.
Mm-hmm.
And then I think I understood you to say that you felt like there should potentially be one in that little square that represents
Do we have a-
8, 20, 35.
Do we have a laser? Do we have a laser anywhere? I think
Yeah.
I know what you're talking about, though, but.
It's
you're
right
talking
there
about-
where Richland Hills, North Richland Hills, Halton City,
Yeah.
Waukon,
Yeah.
and that area.
Yeah,
That's
Okay,
that's
so that might be the fifth
fifth
one.
one. Yes.
From that standpoint. Okay, then moving over to page 22, you talk about the psych, and I know you've added 100 beds to the 2014 recommendation. Unfortunately, Channel 8 carried and I think they're back there, Channel 8 carried a little expose on Monday, I believe. What is today, Tuesday? That's probably it may have been Friday, about some abuse that may have been occurring at Millwood and a couple of
Yeah.
other places. So we may see a couple of those facilities shut down. I remember about 2.5 to 3 decades ago, Senator Moncrief led a pretty good petition that Psychiatric Hospitals of America and some of those places closed down. So that may even put more pressure on this.
yes.
Page 22, I want to be sure, you're saying there in that second bullet, current cancer center is outmoded, too small, and has no room for expansion. Are y'all feeling like that should be torn down, and that the new cancer center, which is, I think, a separate facility, should be built? I don't know if it's in its place, but someplace else.
Well, I don't know what they would do with the current cancer center. I mean,
But you don't feel
it
like-
could,
But
it
what
could
you
be
have-
rehabbed into a
Into something
doctor's
else, but
office
it's
or
not
something.
going to be a good cancer.
Yeah. And what you have now is not.
It's just outmoded.
Sustainable,
It's,
yeah.
it's,
Okay.
you know, I've actually taken some people there. I volunteer for Mid-Cities Care Corps, and that's one of the places that we take people to a lot. And everything going on there is good. It's just packed.
And then
And
page
it-
24, the next one, first bullet point, current patient rooms do not, again, I think what I hear you saying is either don't, really because of all the technology and upgrades that need to occur, you're probably not gonna use those, you could repurpose them, but you're not saying turn those into private rooms and continue to use them. You're saying those probably need to go also and be repurposed into some other use other than a patient room.
We are suggesting replace
Replace them.
them.
Okay,
Yeah.
and is that the same thing with bullet point number 3? You're not suggesting that we would continue to use them as into private rooms, but that they really just need to be discontinued?
Right.
And all of it
Right.
replaced with the
Right.
676
Yeah.
beds?
Right.
Because you
Yeah.
got 3 people in
Yeah.
a room, and you've got a low ceiling. Those are just not the good.
And we didn't just kind of make that decision, Glenn, on our own. I mean, that was with a lot of help
I
from the
know.
consultants
Yeah.
and getting some estimates on, well, what will this really cost us? And it was like,
I just wanted to be
Yeah.
sure I was
no.
understanding.
Yep.
Sure.
And then I guess if I'm kind of looking at this and trying to put it all into perspective, what I hear you saying is a new hospital, 676 beds.
Yeah.
Mental health, 298 beds.
Yeah.
A cancer center that would be focused on providing treatment, and taking care of our cancer patients, and then a
Right.
day surgery center.
Yeah.
And then within our community health centers, I think what you're suggesting that within each one of those, there would be primary care services. There would be some mental health services. And there would probably be cancer care services to a smaller degree, but that the major stuff, the major treatments, radiation, a lot of that stuff is going to occur at the downtown cancer center, or wherever it is. It doesn't have to be downtown, but it's, in all likelihood, it may be done in some sort. You're already partnering to some extent with Moncrief, and so there may be some relationships built there.
And some dental.
And then
some
dental,
dental,
that was
yeah.
the one that okay, and, but also some specialty service, at least a specialist would be housed in those centers to see, and then potentially they would move them, instead of moving them downtown for the operations, it would maybe moved into this day center outpatient type deal,
If they
if they needed
that sort of thing.
if they
Sure.
needed that kind
Yeah.
of, that kind of thing.
Yeah.
Okay. Again, I also, I mean, as everyone has, I cannot tell you, we really wanted the perspective, and the people we put on the committee were from a variety of
Yes.
walks of life.
Yes.
And we wanted that, and y'all have excelled far beyond what I think even we had hoped. And we do very much appreciate
Thank you.
the effort you put into it. And again, what, we asked you to do was not to worry about the dollar signs, but to worry about where we needed to be
Yes.
into the future. And I think that's something that Commissioner Wynn was very, he wanted us, where is medicine gonna be 20, 25, 30 years
Yeah.
from now? And then, we're going from there. Hospital board, I don't know if what questions y'all may have.
Glenn, I'd just like to take this opportunity, and I know there's been a lot of thank yous, but, I have the pleasure of serving currently as chair of the Board of Managers, and most all of them are here today. The actual Board of Managers for the hospital district is actually smaller than the Blue Ribbon Committee. So I want to pass on behalf of our board, I've had the pleasure personally of talking to Lorraine and to you, Randy, and telling you personally thank you, but in our official capacity, thank you for the leadership you have shown. I also thank the entire Blue Ribbon Committee, like everyone else, but also want to thank my board because they've been patiently waiting for this report, and it has been a year, and we have been excited about where the process is. We are looking forward to where the process goes, and so again, for your leadership, thank you so very much. I have one personal note. I've known Randy for many, many years, and when he says he's a very conservative and takes that pencil out, I've served on other committees in the community. I also known him as an outstanding CEO of a hospital. And Randy, I just want to say, I've known you. I love the fact that you now use the word "we" when you talk about the district. So thank you so very much. But I will pass this on to our board should they have any questions or comments. Ralph?
I have a comment and a question. The question I have is that you named 2 other consulting agencies that looked at this. I think you missed one consulting agency, and that was the BOM consulting agency, the Board of Managers.
Oh.
But my question to that, well, two. One is the reports that you viewed from the other agencies, were they consistent with your final recommendation?
Well, they all had different nuances
Right.
in terms of bed recommendations, you know,
Yeah, I know numbers might be different, but I think the overall picture.
but the
The
overall
overall
picture,
picture was the
yes,
same.
yeah, very much so.
The other thing is, I noticed that as you talked about as you visited the facilities all throughout JPS and how crowded it was. And you talked about the staff and how the commitment you saw there. One thing I noticed you didn't comment on, which I think is a plus, that I didn't hear you say at any time there were complaints in the hallway because it was crowded. I say that because even though that condition exists, is that those individuals were still knowing they're going to get cared for. And I think that was a plus.
Thank you, Ray.
Yeah.
I'd like to add too that we had two great folks from the Board of Managers that really, Roy and Trent, were really active participants. Roy would sometimes say, well, I don't think I'm going to talk this much. But then now I have this board I need to make. But so we appreciated their input.
Lorraine, thank you very much, and we've had the opportunity to thank them as they come back to the board meetings and kind of give us a little bit, as like I say, as we anxiously await the process, and they've been very kind to communicate back to us also. So thank you very much for your comments.
Thank you.
You know, and Ralph, I would echo what you said. I think that when we appointed the two consultants, or when we chose them, that they spent a great deal of time going back and looking at the Blue
Blue Cottage.
Blue Cottage.
Blue Cottage recommendations that the board had worked with that group on. And in most of these instances, what they did is they validated the concerns and I believe the recommendations from them, and in most instances added to that based upon that. And then y'all spent a great deal of effort not only looking at those two consultants, but also looking at that. And I appreciate that very much. I think where we are at this point in time and where we move from here, and GK, I'm going to ask you to comment on this. But I mean, I think it's now time to begin taking those recommendations and looking at how we might, you know, go about trying to accomplish those things. It may be cash on hand. It may be public-private partnerships. It may be looking at a future bond issue. But I think that's the work that we now have to set about doing. And GK, I don't know what kind of timeline you may be looking at, but I do want us to move forward on that.
Well, thank you, Your Honor. Yeah, I agree with you. Right now, first of all, this report we've always considered this report and this process, not just the report, but this process, to be really a phase one of a multi-phase process. And what we would recommend is that now we go and do a very critical analysis on the report as a whole, and as it relates to the community and JPS, work with the board and work with the Commissioners Court and develop an effective strategy for implementation of some of these recommendations or all of these recommendations. I think that we can do that and engage with all of you. I would hope that, and I'm going to go out on a limb now and tell you that we will have that analysis and discussions with you completed by the middle of August, so that the court can have some some room to make decisions as how you want to move forward.
And I just hope that we're not letting any grass grow under our feet.
Yeah.
And I do not want to wait until July to begin the discussion, to have a discussion at the middle of August. I would hope that we will begin to see things, if not by the middle, certainly by the end of March, that we're beginning to have discussions and specifically how we're going to go about it. I do not want to find recommendations first coming to us in July without us having had some pretty extensive discussions between now and then. I think in order for us to do anything this year, we must have decisions made by August, so I appreciate that. But I would like to see a timeline that says where we're gonna go, the mileposts we're gonna reach before we get to that decision point in August.
Right, and what I meant is that shooting for the middle of August is after we had all those discussions in a very timely manner so that you all can have those discussions and you can have them with yourselves and with the board, but then come at that point with some direction from the court and on how we move forward. We're not going to, quite frankly, we don't have the luxury of letting any grass grow under our feet on this.
And again, at a minimum, I hope we're having this on briefing at least once a month, if not more, between now and that time frame.
We will.
GK, would you, I got no recommendations at all, but I would think that to move this to the point where we can make decisions, we need to know costs. You need to bring on somebody that can help us facilitate that phase of this, whether it be, I'm assuming there are companies out there that specialize in that.
Well, now Cummings gave us costs for everything, didn't they?
We're going to circle back with Cummings because some of us have really drilled into those reports, and but they're very extensive. And but what we need to do is refine the reports so that it gives almost like your summaries of those reports, and a lot of that'll be answered. But frankly, we've already thought about how we're going to be moving forward with this, and it may be very, very well that we're going to have to engage other people to help us to do this. The goal is to make sure that you gentlemen and the board gets the information that you need in order to make a decision prior to middle of August.
I know the judge brought this up, but I think it's really important to look at how this can be paid for again, whether, like he says, bonds, reserves, or public-private partnerships with some private entity.
Yes.
Not that all of it can be done that way, but maybe a certain part of it. And then, or maybe not, but I think it needs to be quickly as possible looked at to see if that's even a viable alternative, because, if that's a way to do it, a long-term lease or something, I think you gotta lay everything on the table to figure out how we can do this where it has the least impact on the taxpayer.
I agree with you.
Yes, and in addition to that, in addition to what Judge and Commissioner Ficker said, what I like to see, and hopefully the Board of Managers can help with this under the leadership of Mr. Powell, those strategic recommendations, they just don't happen if we don't do anything about it, right? Most of the talks, based on my experience involving with this committee, have been centering around the capital projects, right? But it is the strategic recommendations that will make these capital projects, become effective in meeting the needs of our healthcare, right? So what I would love to see is that the Board of Managers can put together some sort of a strategic plan to incorporate some of these new recommendations into your existing strategic plan, and how do we implement that over the next 10 or 20 years to achieve the effect that we need, and how do we hold the staff accountable to that, and how do we need to reorganize the leadership structure at JPS to collaborate with Tarrant County Public Health and other organizations. Because I know right now you are so focused on the internal operation of JPS. Now we are asking you to lead discussion about behavioral health countywide. We're asking you to collaborate with other healthcare organizations, including Tarrant County Public Health, to deal with preventative medicine and so forth. You are paid very well, but I don't think you have enough time to do all that. So something has to change in order for us to take on that monumental task.
And I do think,
Commissioner, oh, go ahead. I'm
no,
sorry,
go ahead,
Judge.
Randy, please.
I was just- On that, you brought up something that I think we want to make sure that we leave Robert and his team with, and that is, even if we were to get all of this today, this is a monumental amount of work to get done. And maybe I should direct this to you, Charles, but I hope that you will allow Robert the resources he's going to need to enhance his capabilities, because he would kill his existing staff trying to build 4 community centers, a new tower, a new outpatient surgery center, that is a lot of work. And so I don't know how that works with the Board of Managers, but I just want to let you guys know, please give him the latitude to spend a little bit of money so he can enact the stuff that you guys are hopefully going to vote on. The second thing I was going to say is, we all know about construction inflation. It's rough right now. Well, medical inflation is just as bad, if not worse. Construction inflation may slow down a little bit. Who knows? I doubt it. Medical inflation, as far as construction, new equipment, never slows down. So the longer it gets kicked down the road, you're going to have another Lorraine and Randy up here giving you some new recommendations, because that cost just keeps going up and up. So time's of the essence.
Judge, and then I just wanted to say, just listening to this conversation between you and GK and the Board of Managers, I feel redeemed, because you have heard us. You've come to the call to action. You want to move this. So many times we do these reports and they sit on the shelf, and nobody does anything about them. But with your push to get this done, and I know GK has been saying that to us as a committee as we were meeting, that we're going to try to move this. But thank you for that. I feel really good that you're doing.
And I guess the one thing that I'm going to hope for, I'm going to ask GK again on this, and Charlie, if you're agreeable. I really don't want it to, I want us to go down this road together. And I don't want us to kick it back to y'all and say, okay, y'all spend 3 or 4 months working on it, and then y'all bring I would rather, when we have those meetings that we have, is that we really make a point to try to have them jointly.
Yeah.
I hope that we can begin, I know that Cummings had rough estimates, and I would like to see some effort put at really trying to better quantify exactly what those estimates are, but I'd like to have some numbers by the middle of March. And let us begin to go about that process of deciding, somewhere in here there was a parking garage. Well, to me, that's a prime candidate for something that could be built by the private sector. And I don't know what else is. I think we should look at each one of them and determine how we can best do that, and whether the private sector is a alternative or a possibility. But again, we've got to start someplace. And I think we need to start with those numbers. And I really think we need to be around the table together to talk about this, and not, okay, y'all go have your meeting, and then we get a report about how that meeting went.
Glenn.
As opposed to us sitting down and having a meeting.
Yeah, Glenn, I was just going to follow up. I don't think there's any hesitation on this board. Majority of them are sitting right here. I think we're ready to do that. Certainly heard what Commissioner Wynn said. And Lorraine, you said it best. I think you hear people saying, let's do something and let's move forward for the outstanding work that the Blue Ribbon Committee done. So, Glenn, I'll commit to you on behalf of this board. As I indicated earlier, I think I've been trying to hold them back waiting. This is the first joint meeting, and I appreciate that. This is the first actual meeting, Blue Ribbon Committee, the commissioners, and the board. And so if we can't leave this as a kind of a uniform working together relationship, Glenn, we're committed.
Thank you.
Judge Whitley, I would say absolutely you can find some partners to help you on pieces of this. The outpatient surgery center, community centers, the parking garage. There are a number of players that would be more than happy to entertain opportunities that could be mutually beneficial for John Peter Smith and the community as well as them. So you're right on that.
Judge Whitley? I'm all about having joint meetings, but what I'm concerned about is I've got about 30 to 45 minutes of questions, which I actually wrote down based on the presentation that I heard today, and we're not going to get to any of them because we have a lot of people that have the time to take to say thank you for the work that you did, which is an important thing to do. But we have to have at least enough time. If it's a weekend retreat, it's a weekend retreat. We're going to have enough time so we can actually address the questions in a substantive, real way, and have time to do that. Because we're not going to get to any of my questions today.
Why not?
Past that. And so.
You got to go someplace?
No, but we're well on our way.
Ask the question.
When's this thing supposed to end?
Well, when you finish asking your questions.
Well, we can just, how about if I just start and when we get tired of hearing my voice, it'll be fine. On page 43 then.
Now that we're finished. No, go ahead.
Be kind.
Let's do some quick intros.
What page?
Page 43 of the larger book.
We have our consultants here also.
This second paragraph says, the committee, Blue Ribbon Committee, is charged with coming to a conclusion about the need to fund and implement the JPS Strategic Facilities Utilization Plan and Capital Construction Project, including any revisions to those plans based on community health needs. Did that happen? Or did we hear it? Or am I just making stuff up?
Now, are you talking about the collaborative strategy? Is that what you're talking about?
I'm just reading the paragraph and saying this is what it was charged with. I don't recall that being charged with, because I don't know what the words were. So I'm just asking if you think this occurred, or if this rings any bells to you, or what this means.
Yeah, we recommend collaborative strategies to improve the health status of residents in an effective and efficient manner.
Okay.
Well,
Yeah.
Go ahead. Go ahead.
No, that was our charge, and that's what we really feel the recommendations that we've come up with address that.
So, Lorraine, the question I had, if I could just follow up with Warren's comment, when you're making reference, I think, Warren, to the JPS, you went back and looked at, we talked about Blue Cottage, we talked about the Boca Powell, as Ralph knows as former chairman, we've been looking at things for several years, and we're establishing something as this process was moving forward. Y'all went back and had access to all that information from JPS and our consultants.
Yeah,
Yes.
2014, and
Right.
yes.
Okay.
Yes, we looked at NASA. Yes, sir.
So Warren, that was a lot of the work that was done by Cummings. They reviewed all of your plans.
Right.
And your strategies. And it's some of that, some of the responses are embedded in their attachment. You may need to go to the website to look at that attachment.
Typically, when I have a plan, if somebody brings me a plan, an implementation of that plan, I see, here's our goals, this is how we're going to meet those goals, and I can see that. I just didn't
But
see that.
but we were asked to come up with recommendations.
So you'll see that in a lot of
Yes, it's on the attachment.
I have a question. A couple of times we talked about the semi-private rooms versus private rooms. I'll just, from the time I was 5 until I was about 17, every year I went to the hospital for about a year because I've got no inner ear, no eardrum, any of that, and water just kind of goes into my head, which is probably where all the problems come from. So I spent a lot of time in hospitals, and I was always in a ward, 4 to 6 kids. Now, I understand we have HIPAA today, and we didn't have HIPAA back then. But whenever somebody says, I want you to raise taxes to give health care, I'm okay with that. But I want to give it for health care. And if somebody says, I want you to raise taxes more so somebody can get something that's what I call it's a benefit, and it's not a wrong benefit, but the idea that I have a right to a private room, and I do less health care because I'm spending that money on private rooms. And I know we can't save 1/6 of the money by paying 6 people in the room. I'm not suggesting that. But it sounds as though you're just saying, no, we should have private rooms everywhere. What's the story on that?
Well, the standard is private beds. There's
The
no-
standard is that everybody is paid for by a third-party payer, right? Nobody pays for their own health care anymore. So it's easy for that creep to occur.
Well, I mean, we can discuss creep, but then now we're going to try to undo the past. But I'm just saying that, a lot of people don't think that there is free care being provided in the suburbs. Every single one of them provides free care. Every one. They provide a lot of it too. In fact, JPS, we would absolutely. You think the lines are long now? We'd kill them.
Yeah.
Okay. That's just the way life is. But nobody differentiates when the person comes in the ER. That's a non-pay. Put them over into semi-private. That's just not the way you do things. And so I'm not saying that you should never have semi-private beds again, or that semi-privates are evil, or that horrible care is rendered there. I think our goal was to try to establish what we wanted as to be able to provide to our community. And if I was today building a hospital anywhere, I would go with private beds, not only because it's a standard, and not only because of HIPAA, and HIPAA may be one of the lesser ones, but as far as infections, as far as the privacy of the family to be able to sit there with their loved one, and nowadays that's a big deal. We often have the patient with the loved one that literally stays there all day long and is sometimes the communicator to the nurse because the patient can't communicate, or because that person understands that the way Dad's talking right now is not the way he usually talks. All of that stuff is part of being in a private bed. And if this was 40 years ago, I'd probably be right there with you, but it's not. And
But
I
you
don't
realize
think
that we have to spend money.
I don't think your savings and I can't prove this. I'm sure that our consultants could get some statistics on this, but I don't think you're going to get enough of a savings by doing semi-private beds to make it worth your while. I don't think you'll be happy with the final product.
Could you imagine 3 psychiatric patients in a room?
Well, I could describe a lot of situations that are unpalatable. That's not the question.
Okay.
I wasn't suggesting that.
Okay.
I'm simply suggesting that it's easy to say let's go private whenever you're not spending the money. We're spending the money. We have the choice of spending more
Okay,
money
next question,
on
because
more
we're not going to agree on that.
Okay, so
Wait
we don't have
a
to agree or
minute.
disagree. I was looking for a comment.
Infection control is something that you
Yeah.
mentioned very briefly,
Yeah.
but it's probably the most important consideration.
And it's one of the hardest to measure. Yeah.
That's fine. Okay, let's go to the next question.
One of the things, though, Randy, you put 2 patients in a room. You have to double the equipment. The same equipment, just got to do it twice.
Yes.
You've got to add more square footage to the room.
Yes.
So
Yeah.
I think the savings is insignificant.
In my opinion, the savings is there, but it's too small.
Too small.
It's not going to it will not make a difference to your decision on how you fund this project. I can assure you that.
But
I
what
think
about
somebody-
patient care?
I'm
Yeah,
sorry. I think somebody back here
Yeah.
had a comment.
I was just going to add to that. I mean, it's not only a standard, it's a requirement. You cannot literally cannot build a hospital with semi-private beds today. So it's a regulation. So, and it's also not just there are things like infection control. It's actually there's a lot of studies done on essentially it's more fiscally responsible to build private beds because of essentially healing environment actually reduces length of stay. So there's a lot of studies about
If there's a
that.
regulation that says we can't do it, then
Yes.
just tell me what the regulation is and we just go on. You don't have to convince me, right?
Okay.
It's a law.
Well, and then there's a lot of costs and efficiencies to having.
Just give him the regulation.
Okay.
I don't argue with laws.
Yeah, okay.
Thank
There are a
you.
host of other
Thank you.
issues involved with that. That's why that regulation exists.
On page 50, we have this facility planning, finance, construction schedule. And step one is to secure funding. I think that if anybody came to me and said, give me a bunch of money and I'm going to do great things with it, I would want to know what those things were. I'd want to know the project planning and project design before that. So I'm wondering why we have secure funding before we have project planning and project design.
I can answer that question.
Sure.
I don't think that what this chart shows or what it means is that you go raise the money and then you begin the planning. Planning process, we've already started the planning process. We've heard what the court has said about, and we'll be getting back with Cummings on costing and things such as that. So those activities and the planning activities will be part of, we'll start that right away, quite frankly. But to go into a very deep analysis of what all these buildings look like and things like that, if we can't agree upon where the funding sources are, then we basically are trying to put the cart before the horse on this thing. You've got to identify the funding sources and use the term sources, not source, because there's different revenue streams that we can look at. But to say that we're just going to look at the money first, no, that's going to be all part of the strategy. And this chart may not be as clear on that as it appears, but our goal is to start the planning efforts and, quite frankly, utilize what Cumming has generated, what Blue Cottage has generated, and to start shaping how we and what we are able to build. So don't read that as being identify all the funding first and then do the planning. The planning is going to occur in that cycle also.
Thank you. On page 18 of the slideshow, we talked about the partnership with Tarrant County Public Health. Frankly, I thought we already did this, and it was just already a thing. And I'm amazed that this is a thing that we have to wonder about. How many dollars are involved with this, and what are we talking about? I mean, obviously, for JPS, we should be dealing with Tarrant County Public Health to focus on disease prevention and social determinants of health. Why does this cost money that we don't already have and already spend on this process?
Well, it's not that they don't do it at all, but again, our emphasis was in trying to get them to collaborate even more. Putting a price tag on it, I'm not sure. I mean,
We didn't even discuss that.
No, and it didn't require, in our opinion, it did not require us to come up with a price tag. That would ultimately be up to you all in the administration to come up with that. But it would not be a capital expenditure of any sort, that's for sure.
I mean, it just seems like this is something are we not already doing this?
Yeah.
Well, I think several of the items, several of the items are on there. Lead planning efforts, the whole building and retaining work, all those things are ongoing. And I think what they're just simply saying there is we need to continue going down the path of working with Tarrant County Public Health with regards to these things. There will always be a need to continue and to focus the emphasis on whatever the need that specific need may be in the future year.
Judge, I'd just like to say Commissioner Wynn's already asked for us to really to dwell into the strategic plan as part of the cost factor. So I think all these issues we as a board are going to start addressing those. I mean, I think they've been addressed in the past. I think this is an extension of that. But Commissioner Wynn's already asked us to look into that, and we've committed to that. So I think some of this will come out when we do our workshops and we work as a board. So Commissioner Wynn may have something else, but.
Right. A lot of these things have been done at some level. That's why I asked earlier the board to go back and revisit some of these strategic recommendations and find ways to streamline it, expand it if necessary, and make it more effective, and also include accountable measures to it, right?
All right.
Okay.
Thank you. On slide 20, the map that we had earlier, if we were to do an overlay of the indigent population against these, our current healthcare centers and our locations and these new ones, would they match up?
The new ones aren't on page.
So you're talking about 21?
21?
Well, I'm talking about 20 and 21. We have obviously a lot of existing facilities that are not on either of these two pages. And so what I'm asking was if we're talking about building new community health centers and other organizations, our charge is to indigent healthcare. That's our charge.
Right.
And so to me, and you're going to hear this from me all the time, spending the dollars for health care for the indigent. So trying to buy the suburbs support by putting a healthcare facility down my street, it does not help me. That tells me they're trying to do something that's political, as opposed to doing something that serves the indigent health population, the indigent healthcare needs. So if this matches the indigent healthcare population, then that makes sense.
Let us talk to you a little bit about how we got there. Sam?
Yeah, I can address that question. I was kind of in the weeds of doing the analysis of where to place new facilities. So if you look at the footprint, and especially as you think going forward, where to put new sites, we actually developed an entire criteria looking at various metrics. And the major metric we looked at was the indigent care and how JPS is serving that population today and where there are gaps in care. So when we developed strategies for the 4 new centers, one of the major criteria that was looked at was where those gaps in the indigent care in terms of access to primary care. So all the new sites were put in mind by saying, what is the right size footprint for JPS for delivering care to the indigent population from a primary care perspective? And that is what informed the decision to build and place those new sites.
Okay.
Going forward, I'd like to see that overlay. You know,
I can tell you Northeast Tarrant County where we have the one in Hearst, which is going to move over to Euless, and the one on Ruth Snow, which is the Gertrude Tarpley Center. I was there for when Gertrude Tarpley's center was built, and that was right in our footprint, right in our backyard. And as far as the politicalization or pushback, or there was absolutely nothing negative I ever heard when that center was put in. And the only thing I have ever heard was positive from the community on the Gertrude Tarpley. I wasn't there when they built the one in Hearst, but I've never heard anything either. So if that's a concern that the neighborhoods might be upset, I don't think that's going to be an issue.
Thank you. On page 22, we have a new facility with 298 beds recommended. That's an interesting exact number. How did we get that number?
Help us consultants, how did you come up with that? It was with
It is a
the,
simple
I mean, it was with their numbers, yeah, based on the population, behavioral.
How many beds on the floor?
And trying to get to a certain percent of people that needed the care. So we knew we couldn't do 100%, couldn't do 50, so we tried to come to a number that, based on what HMA and Cummings had recommended to us, that was a viable number.
So the real number that was recommended to be that we should, to meet some arbitrary standard that somebody set up, is how many?
It was over 500.
Over 500,
Yeah.
yeah.
So we
It was
decided
much larger.
to just take half.
So, okay, I can speak to that. So,
Why don't you speak in the mic so we can hear you?
Speak in the mic.
so, in the literature, there's been,
Speak in the mic, right? It's not on.
Well, help her turn it on.
is this better? Okay.
Pick up your other one again.
Use the voice as if you're yelling at your kids.
Okay, I think it's on now. Is it-
Warren.
Okay, I
Warren,
need to look at some
page
of my
40.
notes.
You find the information you're looking for.
Okay, so in the report on page 38, there is a table that describes how we went about doing this. And there's a certain number of beds per 1,000 that is recommended for public psych beds. And so we have that. I'm sorry, that's 38. I'm sorry, that's not. Here it is. Okay, so yeah, it's table 5. It's on page 40. You're right.
Page 40.
Yeah. Okay. So total public beds needed in literature-supported level of 70 beds per 100,000 population. So what we did was take the population currently and project it out over the next 20 years and said, okay, this is how many psych beds, public psych beds would be needed in Tarrant County in 2037. That's 2,064. total public beds needed with investments in new program. We've been talking all afternoon about investing in ambulatory care, in community behavioral health, just like community primary care. And if those investments are made, then we're going to assume that we need, we're saying 50% of those public psych beds, because much of the care would be provided in an outpatient setting, and people would be better managed. So then we're saying, okay, JPS beds required to meet target of even 50% of that, because there are other psychiatric hospitals in the community as well. So we said 516. So that was kind of a population estimate that we thought was reasonable for the need for public psych beds. And in terms of JPS's contribution, I don't believe that it's reasonable to expect that we would build a psych hospital with over 500 beds. And so we came down even further and said, okay, what is the percentage of psychiatric beds or of the need that's being met currently? And for the psych beds right now, it's let me see, behavioral health. It is about 28% of the need of psych beds is currently being met by JPS in the county right now. So we said, okay, let's take a look at that 28%, and so we extrapolated and came out with the a recommendation.
I think I got it. So would it be fair to read that sentence to say a new facility, the recommendation, a new facility with 298 beds is recommended to add to meet 50% of the assumed need in 2037 based on other area offerings?
Yeah.
Is that fair?
Well, it's
Fair-ish?
Look on page 40.
I'm looking at
41
it.
of the report.
Okay, that's
You
fine.
see our
I think I got it.
Okay.
Did the Blue Ribbon Committee look at the fact that we have $200 million sitting in cash and that we could be used to build something?
No, we really did not get into the financing piece of the equation.
Well, the reason I ask is that both of you mentioned separately the fact that we have not financed anything since 1985.
Yeah.
Though we have built facilities since 1985, right?
Right.
But both of you mentioned that, and if one of you had mentioned it separately, I wouldn't have asked it. But it seems like this is important for you to mention. It's a good talking point. We haven't financed something since 1985. Why does that matter so much that both of you decided that was important enough to mention?
Well, I thought it showed, the 1985 showed there had not been a comprehensive financial picture and doing anything for the hospital since 1985. We've done spot stuff, spot things.
You kind of shoehole things in
Yes,
to
but we
a
have
existing
not done
facility.
a comprehensive.
Right.
Well, I just
Look,
wonder because
yeah.
both of you said financed since 1985.
Yeah.
1985, we did a bond. I felt that was
the
tied.
last
Yeah.
so
Right,
that
I
was the
understand
last
that.
bond.
But we didn't talk about in the Blue Ribbon Committee, you talked about the financing that was done in 1985. You didn't talk about the $200 million we have sitting in cash.
No.
Again,
We
did
were not
ask them
authorized.
to do that.
We were just not authorized to talk about funding. It was merely a descriptive term.
But if I could also, on behalf, Warren, I think it was Judge Whitley who mentioned there's been no determination how this need is going to be financed, whether it's private-public partnership. I think you actually use the word cash and/or bond possibly. So I don't think the ultimate funding of how we're going to do this, that's part of, I guess, what we'd call the next phase as we start having these joint meetings. Glenn, is that what we
That's the
anticipate
board
in
of
that?
managers
Okay.
and a.
Right.
That's the direction that the court gave me.
Yes, and so those questions, Warren, I think will be addressed as you and the others of this board attend these upcoming meetings.
We actually, deliberately, not only were we not charged with it, but when that question would come up about financing, we didn't want to talk about that because that wasn't our charge. Our charge was what are the needs?
Right.
And then the rest of it's y'all's.
That was-
Well, we just talked about a figure for a number of beds that's based on an assumption. We're not meeting the needs, and we aren't ever going to meet the needs, right? I mean, that's just the bottom line.
Well,
There's
I was
always gonna
thinking,
be a-
and I would hope that as we go through this process, that the state will open up some of their facilities, that
Yeah.
beds that they've closed. I would hope that the federal government, there's a pretty good discussion going on about behavioral health. And I guess we could always hope that the state and the federal will quit putting things on the local
Yeah.
and just doing unfunded mandates.
Well,
Next
what we do
question.
know is that things are going to change in the next 20 years. And this is just and I have two comments and we're done. And we talked about this in the Board of Managers. We pay, doctors come and they work with JPS for more reasons than just pay. Right? Just like a district attorney goes to work for the DA, they don't make as much money. They see a lot of action. We have machines at JPS that few other hospitals in the nation have. Yeah, people can come here and get experience that they can't get but a handful of other places. So, once you start making a few dollars, now you do have to meet a standard. But once you beyond a certain point, people are not always motivated by just money. So having a great facility is important to that, and having a great set of machines and the bells and whistles, where people can get a lot of experience is important. But meeting some arbitrary salary, I never understood that. Why we think we need to compete with San Francisco or Miami or wherever. And then my last point is that I understand people would like to say we're going to have a zero wait time. But if I have a zero wait time, it means I've got staff and medical people in buildings that are not being utilized to the extent that they could be. We're offering people free health care. That's what we're giving them. I think that trying to say it's unreasonable that they have any kind of wait time or more than what people who are paying for their services would get is unreasonable. We have to spend the dollars on indigent care and allowing, if you have any free service, whether it's free food or free anything, the system makes up for it. Nature finds a way. You get a queue. You get waiting period. That's the only way the system knows how to do it, because you're taking away the money aspect. So although obviously we don't want inhumane conditions, obviously, that's not where I'm going. But I don't like it when I hear us saying we need to effectively match what every private hospital does or may do, or try to make it so that it's the same experience as a privately paid experience. I want to spend the dollars on indigent health care, and that's it. So I hope that our recommendations start to reflect that, or at least they do. So, thank you.
I did not, maybe I was sleeping, I didn't hear zero wait time, and I haven't gone to an emergency room ever that you're not looking at about a 3 or 4 hour wait. I mean, I'm very sincere. My wife works at THR-HEB, and I've seen people wait 4, 5, 6 hours in there. Now maybe they don't anymore. They used to walk away from JPS and go to other places because of the length. But I would not envision us ever getting to a point where there is a zero wait time.
We just compare ourselves to area hospitals on a lot of things.
So there's not an area hospital I know that's got a zero wait time.
No, but I'm not talking about emergency room necessarily.
Well, anything.
Yeah, let me add a couple points. I think it's really important that we, like I stated earlier, I attended a lot of these meetings, and because I'm a nerd, I read every report that came out. So basically the healthcare market is controlled by the payers, okay? If you want to be reimbursed, if you may spend $1 and you get reimbursed 65 cents, and if you want that 65 cents, you have to comply with the certain rules and regulations, including quality metrics. And one of those metrics are basically the time that people have to wait and so forth. So even though we won't be able to ever come to a zero wait time, which is ideal, but it's not possible. It's not possible. And some of these recommendations, correct me if I'm wrong, currently we are meeting about 20+% of the healthcare needs of the indigent population, right? 30-something%. Right, okay. What we are doing here, the recommendations here is just for us to maintain that same percentage threshold, given the increase in population. We're not even attempting to increase above the 38%. You see what I'm saying? Because we're expecting 1 million people will move into Tarrant County within the next 20 years. And of that 1 million people, we're adding an additional 400,000 or so of indigent folks. Something like that, okay? It's all in this report, okay? And basically what we're trying to do is we want to expand the capacity enough to maintain that 38% threshold. We're not even trying to expand it, okay? And I think with you being an attorney, if you read this report, it will provide a lot of interesting information in there.
And I would also just add that our ad valorem tax, if you look at the total budget, our ad valorem tax is probably somewhere around 30 to 35% of the total revenue that the hospital district brings in. The rest of that is coming from sources that many of the other hospitals get, and that's Medicaid, that's Medicare.
Medicare, Medicaid.
So your ad valorem tax is only providing about 30 to 35%. And as a court, I would tell you we have been pretty consistent about that, and we are pretty consistent about not, when we look at businesses that are coming into this community that are asking us to help them come into this community, they better be offering insurance or they're not getting help. And in most instances, we do not provide any cost from the hospital district because we know that what y'all are providing out there is very, very critical, very, very important. So again, we are very, in some extent, stingy with the public dollars, and at the same time, we do help the other community hospitals with our intergovernmental transfers, where we send money to the federal government and much more money comes back to the other hospitals within our community. And we even help by sending money to the state, which they distribute to other areas. It's kind of like the Robin Hood of the schools. It's the Robin Hood of the hospital districts. So we do whatever we feel like.
Thank you for your patience. And by the way, I do know this is a lot of work by everybody involved, and so
Thank you.
Thank you for your question.
No, I think the questions are good.
Yeah.
The questions are good, and these are questions that we're going to run into as we proceed.
Please.
So, thank you.
I think we've done it, but everybody did thank you. But I hope that everybody, if you had questions, we came here to ask questions.
Absolutely.
And Warren, I appreciate you doing that. I would have been a lot more upset if you left and then said, "Why? We really didn't ask any questions."
Yeah.
Well, I felt I had to butt in.
No, it's okay. Yeah.
That's what we're doing.
You and I think I referred them to a few pages and asked a couple of questions too. So I think that's the goal. That was the purpose of the meeting, and I know our folks would love to get out of here. But
Among consultant row.
Sam, did you have a comment?
Yeah, I'm sorry. I just want to make a quick comment about wait times because I understand your point about being fiscally responsible, but along those lines, it's actually very fiscally. There's a lot of studies around, especially the indigent population, where if they don't access care within a certain time period, they're much more likely to forego care. And so if you have chronic diseases, you're trying to prevent that, and trying to prevent an admission down the road that's going to be, frankly, much more costly to get yes to the county. It behooves the system to create that access and lower the wait time so that that need is there, that need is met, and there's actually a tight time frame to meet that. And if you don't meet that, then it actually becomes more costly down the road. So while the goal may not be zero wait time, it is important to have that access and that availability because it will reduce costs.
well, and then if they walk away from JPS, they're either, like you just said, they're either not going to get the service or they're going to walk right down the street to THR or to Baylor or to Medical City. and they're going to,
Yeah.
then we're gonna have each one of those CEOs calling and screaming. They're gonna scream, they're gonna call and scream at me, because I wanna just tell you, the first couple of years, or the first 6 months I was on here,
Yeah.
I was getting some pretty regular calls from
I know you were.
the three.
I didn't do it, Doug. I just want to make sure you do that.
You had my partner do it.
You know, another really important point related to this conversation, another really important point is that JPS can't just take care of the indigent. Given what they've gotten in terms of your ad valorem tax, there's no way. The modern-day public hospital has to compete in the marketplace. The indigent care will be subsidized in part by commercial insurance, by other insurers. That is really critical of the right payer mix to be able to allow this public hospital to survive. So, really important. And you're not going to survive if you have 5-month waits for people who are paying to get in. So.
I want to thank everybody. I would like to have a motion to receive and file the, would you like to make that motion, sir?
I'll make that motion.
Second. We have a motion and a second. All those in favor say aye.
Aye.
Any opposed?
Hey, Glenn, I think we thanked everybody in this whole room except for GK. GK was the point man of this whole thing.
And with that, I will adjourn the Commissioners Court meeting.
And at this time, we'll adjourn the Tarrant County Hospital District. Thank y'all.
Thank you.
Thank you.
Okay. Yep.
When you parked over there when they had, well, hell, I just hit right the first spot. I'm over on that other side.